a video to see the scanning plan for the gallbladder in supine posture, and then moving further. This is the subcostal region, this is the mid region of this diaphyte process, lower region, mid region, subcostal region. Rotate the probe, enter the subcostal region, and then angle the probe towards the patient's left side so that you will get this view. Now this is exactly the place from where I showed you. We have just seen the plan in which the fundus is being cut off and rest of the anterior and posterior wall with clear lumen of the gallbladder with the portal vein at right angle, and this is the inferior vena cava in longitudinal section is seen. Now if you ask, this is one way. At times, most of the times you get the gallbladder in this way in total. If you don't, then there is a trick that you place the probe below the costal margin. लंबा सांस लेकर सांस रोकना. Ask the patient to take a deep breath and hold it, and now you see you can get the total of the gallbladder. Now this is where I am. In this case, now this is scanning plan number 2. Place the probe below the costal margin. Same, this is the almost mid region of the subcostal area. I have placed the probe below the costal margin at about 60-degree angles with the marker pointing towards the patient's right shoulder. And from here I angled the probe in this direction towards the patient's left shoulder and asked him to take a deep breath to get the view, because by just placing in this angle, in this way or this way, I am seeing only bowel gases and nothing else. So remember, first point, you will see that this is the subcostal region, mid region. Angle the probe, ask the patient to take a deep breath and hold it. लंबा सांस लेके सांस रोक लें आप जितना ज़रूरी है. And here we are. Now you see on the translation ultrasound that in this view I can get the gallbladder with fundus, with portal vein, and with hepatic vein. So this is one of the another ways of, and this is the another way of seeing the gallbladder along with the and the third one, curvately. Ask the patient to turn to the left lateral decubitus posture. And then place the probe as you placed it below the subcostal region. Angle it in the same way, and you will get the gallbladder in its full length. If not, you can ask the patient to take a deep breath and hold it. See, again, this is what I was doing and placing the probe when the patient was supine. This is the subcostal area, this is the mid region. Place the probe perpendicular, angle it acutely towards the patient's left shoulder, and here we are. See what I am getting in this time. So I am getting all of the gallbladder in total length, so I don't have to ask the patient to take a deep breath and hold it. So in this way you can see the gallbladder. This is the third way of scanning the gallbladder. Now one thing is very important, we should always see the fundus of the gallbladder. Most of the calculi are at times lodged in the fundus of the gallbladder, and as fundus has many different shapes and as well as many different locations, anatomical locations vary from patient to patient. So always see the fundus of the gallbladder. Now, to see the fundus of the gallbladder, it's very easy. See, you just place the probe again. Now you place, this is the subcostal region, this is the mid portion. Place the probe like this and angle it downwards. Place the probe below the costal margin and angle it downwards. And angle it downwards till you get the full view. And this and move the probe upwards in case if you want, if you feel like, if you are getting the fundus at this region, by moving the probe downwards, fine enough. Not, move a little upwards. If not, ask the patient to take a deep breath and hold it so that you can get your desired view. Now here we are on the ultrasound. Now in this particular patient, this is the fundus of the gallbladder. You can't miss a stone in this region. So now here we are seeing the fundus with the body, anterior wall, posterior wall. This is the portal vein that you will be seeing in this scanning plan. This is the inferior vena cava. This one. This is the aorta, and this is the right renal artery in transversection. So these are the scanning plans for the gallbladder. At times, even if you feel problems, then you may have to ask the patient to stand up and scan so that the viscera come down and you will be able to locate the gallbladder. There is another scanning plan that is when the patient is in supine posture. So you place the probe below the in the epigastric region. Yes, this is the xiphoid process. This is the epigastric region, and angle it. Now from here you angle it towards the patient's right side in this fashion, and then angle it towards the patient's shoulder, right shoulder. If you feel difficulty, ask the patient to take a deep breath. Most of the time, this is the area from where you get the gallbladder. You can get the gallbladder from this area. Now this is the difficulty is in this plan, scanning plan. It is difficult to see the fundus of the gallbladder, but just in case we're getting difficulty in finding the gallbladder, place the probe obliquely in line with the subcostal region, acutely angle it, and you will get the gallbladder as we are seeing here. Now this is what I am getting by placing the probe, and you can see that in this case, by scanning in this plan, I do find the gallbladder. This is the median lobar fissure, interlobar fissure or median lobar fissure. This is the gallbladder, this is the neck of the gallbladder, and this is the landmark for the identification of the gallbladder. So with this scanning plan, in which you place the probe in line with the subcostal area, with the upper part of the probe in line with the xiphoid process, and acutely angling it towards the patient's right shoulder, you get the impression of the gallbladder. You find the gallbladder with median lobar fissure being it's the landmark for identification. Thank you. Now this is another shape of the gallbladder. Most often we will come across this type of a shape of the gallbladder. It measures 8.5 centimeters in length and 3.3 in anterior posterior diameter, and this is the portal vein. If you see, there is calculus along with sludge. This is the calculus, single calculus. This is the shadow of the calculus, and this low level echoes. This is the small amount of sludge within the gallbladder. This is the portal vein, and this is the anterior wall, fundus region, posterior wall of the gallbladder. So the gallbladder is otherwise normal, except that you see calculus along with small amount of sludge within it. So the gallbladder has different shapes and is located differently in every patient. As for example, in this patient, the gallbladder appears to be folded upon itself. This is the posterior segment, this is the anterior, this is the fundal region, and you see it appears to be folded upon itself. So the fundus is going downwards. This is one of the shapes that you will be seeing in some patients. And you can see that the landmark is running at right angle to the neck of the gallbladder, the portal vein. So this is a normal gallbladder. Only thing is that it is folded upon itself. And you can see here that this is the portal vein, and this is the common bile duct that runs anterior to the portal vein. Thank you. See, this is the commonest shape that you will be coming across that of the gallbladder. Patient in supine posture. Now you will place the probe available. You will get this with patient supine and placing the probe just above the intercostal space in the sixth or seventh intercostal space. This is the subcostal region, and this is the intercostal space, and then you angle the probe a bit. In this will be your angling towards the left shoulder of the patient, or angling a little bit. You may have to go upwards a little bit in some patients, and then with the same maneuver you will be able to get the view that is in front of you that I am getting from this position that I have showed you initially. Now this view, you see that this is the gallbladder and this is the common bile duct. This is the inferior vena cava. This is the lower vena. So the portal vein runs at 90 degrees angle to the neck of the gallbladder. See, this is the commonest shape that you will be coming across that of the gallbladder. With patient in supine posture. Now you will place the probe available. You will get this with patient supine and placing the probe just above the intercostal space in the sixth or seventh intercostal space. This is the subcostal region, and this is the intercostal space, and then you angle the probe a bit. In this will be your angling towards the left shoulder of the patient, or angling a little bit. You may have to go upwards a little bit in some patients, and then with the same maneuver you you will be able to get the view that is in front of you that I am getting from this position that I have showed you initially. Now this view, you see that this is the gallbladder and this is the common bile duct. This is the inferior vena cava. This is the liver. So the portal vein runs at 90 degrees over to the neck of the gallbladder. There is one another method that you must use for the visualization of the gallbladder, and that is ask the patient to turn to the left lateral decubitus posture and place the probe. Now this is the xiphoid process, this is the subcostal region, and these are the intercostal spaces. Okay, these are intercostal spaces and this is the subcostal region, margin. Place the probe at the epigastric region, longitudinal with the or in line with the subcostal region. Here you have to place it at the upper third. In some patients you may have to come down in line with the subcostal region, but normally to see the gallbladder in this view, it's better to place the probe here and in line with the intercostal space. Now if you can see the gall, and then this is the straight, when I place the probe straight, and you have to angle it towards the shoulder of the patient or the axilla of the patient, little angling anteriorly, wherever you get the gallbladder. If there is any issue, then you can ask the patient to take a deep breath and hold it. In this view, you will be able to see the neck, so especially the fundus of the gallbladder, which is very important to be seen. The reason being, at times stones are present at the fundal region. So let's study this maneuver, and it will be placing the probe, patient in left lateral decubitus posture, placing the probe in line with the subcostal region, and then moving the probe where you can get an impression of the gallbladder, and then angling the probe in this direction. This will be your pivoting and this will be your angling, and if needed, if required, you can ask the patient to take a deep breath and hold it. Now let's have a view of this on the real-time ultrasound machine. Now here the patient, I have placed the probe in the subcostal region, and with patient in left lateral decubitus posture, I have placed the probe below at the subcostal region where I showed you, and here I am getting the gallbladder by angling it towards the axilla of the gallbladder, axilla of the patient. Now this is the gallbladder, but I don't think this is a good view. I will have to ask the patient to take a deep breath and hold it. Lamba sa leke sa rok lo. Now patient has taken a deep breath. He has holding the breath, and here you can see, we see a better view of the gallbladder. This is the gallbladder. Once again, let's do it. Lambasa. Here you will see a beautiful view of the gallbladder, in a sense that this is the gallbladder and this is the portal vein, and the study of the gallbladder in this view. And now there is another view to be seen, to be used in case patient in left lateral decubitus posture. These are the intercostal spaces. This is the subcostal region. In the 6th or 7th intercostal space, better in the 6th one, place the probe here and then angle it towards the left axilla of the patient. and you will get a view of the gallbladder. We'll have to maneuver a bit, ask the patient to take a deep breath and hold it. You will get the gallbladder. Let's see it on the ultrasound. Now see, here I have placed the probe in the 6th intercostal space, and in line with the subcostal region in this patient, I am seeing the gallbladder. This is the gallbladder. This is the portal vein. Not a good view. I will ask the patient to take a deep breath and hold it. लंबा सा लेके सा रोक लो जी. And here we are. This is the view of the gallbladder from the intercostal space. This is a good view of the gallbladder in this patient who is not with overnight fast. So these are few maneuvers that you may use for the study of the gallbladder. Now I am in the intercostal space, maneuvering a bit and seeing full view of the gallbladder. Thank you very much. Now again, our young patient. Why I'm doing it in a different positions and different angles to visualize the gallbladder is that you will see a lot of anatomical variation regarding the gallbladder placement. It is different in every patient, in every person. So that's why you may have to adopt a different approach in different patients. Now again, this is the epigastric region. This is the subcostal margin. I will place the probe here, and then I will angle towards the axilla of the patient, and with little bit of pivoting and maybe have to go upwards a bit, I will try to get the gallbladder in longitudinal section, because in this view you will not be able to miss any calculus if it is in the region of the fundus. And so let's try it on the patient. Now see on the ultrasound machine. Now you are seeing that I am getting a very good view of the gallbladder as compared to the previous patient. I don't have to ask the patient to take a deep breath and hold. I am getting a full view of the gallbladder in this posture. This is the gallbladder, and this is the fundus of the gallbladder. This is the fundus of the gallbladder, body of the gallbladder, and I can also see the portal vein running at right angles to the neck of the gallbladder. This is the neck of the gallbladder, this is the portal vein. So this is one maneuver. Beta सांस लो जोर से, साल है जोर दी रोक ले beta. Now when I ask the patient to take a deep breath and hold it, you get even better view. And this vessel pulsating is the IVC. This is the portal vein. This is a magnified view. So this is another case for visualization of the gallbladder with patient in left lateral decubitus posture. You want to see the transverse, just get the longitudinal view and then rotate the probe at 90 degrees, and here we come across the transverse section of the gallbladder. And in transverse section, the gallbladder should not exceed more than 5 centimeters. So this is measuring approximately, because this is a kid's gallbladder. So, and the wall, anterior wall we measure should not exceed more than 4 mm. So you can get both measurements to see whether the gallbladder is distended or not and the walls are thick or not. Thank you very much.